Each and every cigarette you smoke takes on average 11 minutes off of your life. Imagine if you smoke a pack a day. If you do the math, that's about 3.5 hours you've lost just by one day of smoking. In 1 month, you would have lost 4 days off of your life. This is taking so much precious time away that you will not get back unless you quit. Smoking kills about 480,000 people each year in the United States. This is 1 in 5 people. Do you want to be part of that statistic? In a recent study conducted by the CDC, 68.8% of the smokers aged 25 to 64 would like to stop smoking in the near future. In this speech, I will be providing you with the resources and methods in which you need to get rid of this deadly habit. Many people think that when they decide to stop smoking, it will be too hard and that they will fail. But there are many alternative, healthier routes that a person can take to kick that bad habit. According to the Everyday Health magazine, there are certain steps to follow when you decide to quit smoking. The first step is to do this for yourself and yourself only. You can't succeed if you are just doing this for your doctor or to please a family member. You have to want this for yourself and do it only for you. The next step is to pick a quit date. If you usually smoke at work, try to quit on the weekend. If you are not allowed to smoke at work, then make it easier for yourself and quit during the work week. Let your friends and family know of the date that you decide to quit. This holds yourself accountable because you can't keep pushing it back, and it lets them know of the upcoming change that you will experience so they can support you. If your friends are smokers, ask them to avoid smoking around you. Also, avoid going places that people smoke a lot in, such as bars. The next step is to remove smoking reminders in your household, things like ashtrays, empty cigarette packs, and lighters. The final step is to plan ahead for the future and for the tough days. There are numerous ways that people quit. Ultimately, it's what they want to do and what they feel that works the best for them. When trying to avoid giving in, think of when you usually crave a cigarette. According to Barbara Robb, most of the time it's when you are bored, anxious, or restless. Therefore, if you need to plan accordingly. Some people choose to exercise in place of smoking. This distracts them and keeps their mind off of things. According to the United States Department of Health and Human Services, some ways in which people get the effect of smoking is by chewing gum, using hard candy, lollipops, toothpicks, and food in general. Many people do see a weight gain soon after they decide to quit smoking. Sometimes this deters them from sticking with it, but they need to just remember that ultimately it's better to gain a little weight rather than smoke the rest of your life. One tool that quitters use to assist them with nicotine withdrawal is the electronic cigarette. This is not FDA approved yet, but many people try this as it may assist them in their endeavor. According to the Oxford Dictionary, electronic cigarette is defined as a nicotine-based liquid that is vaporized and inhaled used to stimulate and experience the smoking of tobacco. This is by no means healthy, but it does not contain most of the harsh chemicals that a cigarette does contain. According to the New York Times, electronic cigarettes are on the rise in young adults. This means that the regular cigarettes have dropped by 25%, and they have all switched to electronic cigarettes. The electronic cigarette kit ranges from $40 to $200, and the fluid ranges from $7 to $20 a bottle. According to smokefree.gov, smokers choose to gradually decrease their nicotine intake with the following tools. You don't have to use them all, but whatever works best for you. The first is the nicotine patch. The nicotine patch is placed on the skin and supplies a steady amount of nicotine to the body. This helps to reduce the nicotine withdrawal symptoms and the urges that the person has to smoke. Nicotine gum and lozenges are also help to allow people to quit smoking. This directly releases the nicotine into the mouth when it's chewed, and it's absorbed into the tissue of the gums. Nicotine inhalers and nasal sprays are not the most popular, but they are also used to help provide a specific amount of nicotine to the body. This is reduced slowly, which allows the person to slowly lose their nicotine addiction over time. Some people also use medications to help them quit. Chantix is a popular prescription drug that helps to ease the nicotine withdrawal that a person is dealing with. Wellbutrin is also a popular antidepressant and anti-anxiety medicine that actually doesn't contain any nicotine itself, but helps people to get rid of their withdrawal symptoms. Besides medications and devices containing nicotine, there are many other types of support that one can receive. In most cities and churches, there are public support groups that allow you to not go through this alone. You can talk about your problems dealing with this and not go through it alone. Quit smoking apps are also available for a person to have on their phone. These apps provide support and track your progress. Many people are unaware that when they quit, they can actually competitively reverse the effects that smoking has already caused. According to a chart published in the New York Times, 20 minutes after quitting smoking, the heart rate dropped down to that of a normal person. 12 hours after quitting, carbon monoxide levels in your bloodstream dropped to that of a non-smoker. 2 weeks after quitting, blood circulation and lung function improved drastically. 1 to 9 weeks after smoking, shortness of breath and the constant cough that you have always had is almost completely gone. The hairs on the lungs start to work normally and protect the lungs from the bacteria. 1 year after quitting, the risk of getting coronary heart disease is half that of a smoker's. 5 years after quitting, the risk of contracting mouth, throat, esophagus, and bladder cancer is half what it is for a smoker. 10 years after quitting, the risk of dying from lung cancer, which is the leading cause of death among smokers, drops by 50%. 15 years, and lastly, the risk after quitting, the risk of dying of heart disease is equivalent to that of a person who has never smoked in their life. With the information I have given you today and the amount of tools and support to quit smoking, there's no reason that anyone should not at least try. Try to change your life for the better and quit smoking. In just 15 years, you can almost completely reverse the effects that you have previously caused by smoking. In the end, it's solely up to you to change your life or not. Hopefully, you will make the best decision for your future and quit smoking today. Thank you.